Good day. Let's talk about what is a TAVR procedure, or a transcatheter aortic valve replacement procedure. Reviewing the basic cartoon of the heart has 4 chambers, and the lower left chamber, or the left ventricle, gives rise to a big blood vessel called the aorta that supplies blood to the body. There is a tiny door or valve between the left ventricle and the aorta, which is called the aortic valve. Normally, this opens and closes to allow the blood flow out of the ventricle into the aorta. When the aortic valve gets tight and does not open freely, it is referred to as aortic stenosis. This door or valve can get tight. Most commonly, when we get older, it gets tighter, or in certain families, it can be a congenital malformation, which can lead to it getting tight early in life. In such cases, the valve needs to be fixed. So the 2 reasons to get your valve fixed is if it has severe blockage or is very tight, as verified by an echo or an ultrasound, a CT scan, or a direct catheterization where we measure pressures across the tight valve, or if you're having symptoms such as being lightheaded, passing out, having chest pain, or shortness of breath. There are 2 ways to fix the valve. In the first case, with surgery, we can either do a full incision and open up your chest, or a mini incision. This procedure requires you to be in the hospital for generally 3 to 5 days, and it can take up to 6 weeks to feel back to normal. Alternatively, there is a newer procedure called the TAVR, or the Transcatheter Aortic Valve Replacement, where my colleagues go through the blood vessel, in most cases, and they enter backwards and put in a new valve. This procedure generally requires you to be in the hospital for a couple of days, and it takes about 6 weeks to feel back to normal, but it is a minimally invasive procedure. The most common complications with TAVR include the risk of bleeding, since we go through a blood vessel. There's a very low risk of infection. There is a small chance of stroke, and there's a slightly higher chance of needing a pacemaker from this procedure compared to traditional surgery. And because of the risk of pacemaker, my colleagues will often send you home with a home monitor. This watches the electrical cables of your heart for the next 30 days as the valve heals in the body, and the results of this monitor will help your doctor decide if you need a pacemaker down the road. So in summary, TAVR is a minimally invasive procedure which can be an alternative to open surgery to replace your aortic valve if it is too tight. Putting in a new valve can allow easy blood flow from your left ventricle into the aorta to the rest of your body. Thank you. This is Dr. Mehta.